Chairman Smith, Ranking Member Neal, and members of the committee, thank you for the opportunity to share our perspective on the drivers of healthcare costs and the market and policy situations needed to address them. CVS Health engages with millions of Americans every day in their communities, helping families struggling with an often confusing and disconnected system and the rising cost of healthcare. What's driving these costs is understood: greater demand for care, growing medical provider costs, and persistently high prices for hospital care and prescription drugs. Every day we are addressing the fragmentation and the underlying cost of care that starts by making care for Americans accessible and affordable, and most importantly, simplifying the patient experience at every point. Our 300,000 employees across the country work every day to meet this moment. CVS Health supports the committee's goal of addressing rising medical costs, and we want to be a partner in addressing these challenges. We are working to ensure our members have access to the right care at the right cost, and we are expanding low-cost primary care, covering preventative care at no cost to patients, and offering free virtual care to eliminate the barriers to access. We are leading the industry in developing new solutions to lower cost, investing in technology to identify health problems before they become serious, and tailoring treatment to individual patient needs. Today, I'll share 4 ways we're making care more affordable and accessible. First, we're expanding access to coverage that rewards providers for keeping patients healthy. Second, we're reducing administrative burdens, so instead of filling out forms, doctors can actually spend the time caring for patients, all while driving lower administrative costs of care. We know that denial care is a major frustration for patients and their doctors, so we continue to reduce the number of claims subject to prior authorization, and by independent measures, we have the fewest number of services subject to it. When we do receive an authorization request, 77% are approved in near real time, and that number continues to grow. For medications, nearly half are approved immediately, and for others, the average approval time decreased from 3 hours in 2024 to just 34 minutes today. CVS Health's bundle approach now gives providers one approval, covering medical procedures like repeat imaging and medication for specific conditions. For patients undergoing breast cancer treatment, that means a single authorization for an entire series of procedures. Third, we're using competition to address the rising drug cost. We're aggressively promoting the use of biosimilars. We now have the vast majority of members paying $0 out of pocket for these once pricey drugs, and has generated more than $1.5 billion in savings for our customers. And fourth, we're building a modern consumer healthcare platform that we will open to plans and providers. For patients, it's simple: one open app that allows them to own and manage their own healthcare. For 17 million monthly active app users, we'll schedule appointments, refill prescriptions, access preventative care, all in one place, with the goal of helping them stay healthier at lower cost. For the healthcare system, it's a shared foundation we believe will make care more coordinated and affordable. I took this role 15 months ago because I wanted to help shape the future of healthcare in this country. I'm proud of the work we've done so far to simplify the healthcare experience and to make care more affordable and accessible for American families. I know there is much more to do. It requires health plans, providers, employers, all working together. That's why we support reforms that increase transparency, competition, and innovation, particularly among hospitals and the pharmaceutical supply chain. We encourage policymakers to preserve flexibility for employers to offer benefits that meet their workforce needs and to avoid policies that reduce competition or add bureaucracy. We want to work together. First, to explore solutions that bring younger and healthier people into the risk pools. Secondly, expand the definition of preventative care to services that keep people healthy and out of the hospital, allowing people in high-deductible plans to access these services in their pre-deductible phase. Third, address the bad actors who are gaming the No Surprises Act. Centralizing eligibility, automating processes, and increasing oversight can address this abuse. Fourth, accelerate the interoperability of health records to reduce the friction and to help patients manage their health. And five, pass the ECAPS legislation, which allows the pharmacist to practice at the top of their license and receive Medicare reimbursement. This will benefit every pharmacy in the country while improving access for patients and reducing cost. We welcome the committee's partnerships in these efforts as we continue to work to make healthcare more affordable for all Americans. Thank you, and I look forward to your questions and to the additional hearings.